Hi, my name is Blaine Larity, and I am with the Master of Science in Athletic Training program here at the University of Texas at Arlington. And today I'm going to be talking about this case study. It's a compound fracture of the tibia and fibula in a college baseball pitcher. It's a little bit of background about the case. The patient is a male college baseball pitcher who was covering home plate during a rundown where the runner was stuck in between two defenders, in between two bases, and the runner dove for the base that the pitcher was covering and hit the inside of the pitcher's left leg, which he then suffered a compound mid-shaft tibia and fibula fracture. We ran out to the patient. We were able to assess him for any vascular or neurological damage. Then we placed a splint, a vacuum splint, on his lower leg and called EMS. EMS came, took him to the local hospital where they performed x-rays and were able to determine where that fracture was located and the extent of that fracture. For treatment, they decided to perform a fixation surgery, so they put a rod in his tibia and his fibula to stabilize those bones, and then he was released for physical therapy and rehab with us in the clinic. He was immediately able to walk on that lower leg, so we were able to help him kind of progress quicker since he was able to do more things. We started with some range of motion exercises, really getting that ankle moving again and that knee moving as well. And then we transitioned to more into strengthening of those lower leg muscles, so the calves, the tibialis anterior, all those muscles that influence ankle, and some knee, and muscles that also influence knee motion as well. And then we were able to transition into more integrated exercises, so involving more, since he's a pitcher, some upper extremity stuff with lower extremity, as well as focusing on core, hips. And then we were able to progress him into a throwing program, and then eventually he's able to return back, and he's been pitching since about 6 months or so after the injury. So what makes this case unique is if you look on these graphs here, lower leg injuries are extremely uncommon in baseball pitchers. It only occurs about 3% of the time, and then especially a traumatic lower leg injury, so like a fracture, only occurs about 1.4% of the time. So it's extremely rare for the patient to experience this type of injury. In conclusion, understanding more about this injury, how to handle compound fracture, as well as understanding the different steps to take in rehabilitating a pitcher who has experienced this injury, which is uncommon and you probably will not see if you're working with a baseball team or with baseball athletes. It's important to have this resource to understand how to take care of that injury. Thank you.